Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So it's a pleasure to be on again, another Facebook Live. Please feel free to ask any questions, and I'm here to address any questions. As a board certified plastic surgeon, I remove saline implants, silicone implants, and also residual capsules. And as you will see, the, my goal here today is to educate you and help you understand basically what and how I look at breast implant illness, how I manage it, how the many patients that come to me in regards to definitive management and evaluation. I just want to go ahead and address one important point. This was on the Facebook page. One of the patients asked a question, are saline breast implants safe? And I would say I saw well over 300 comments from patients themselves stating no, they are not safe. And remember, this is my take on it from my experience with the many patients. If I see 1,000 patients that come to me, I cannot tell who has saline implants and who has silicone. And the signs, symptoms that a patient with silicone implants, patients with saline implants present with the same. So same brain fog, fatigue, joint pain, neck, back pain problems, dryness of the eyes, amongst other problems that we know of from the 14 different organ systems that are affected. I cannot tell who has what from the many symptoms. Remember, the saline implants, the shell is made up of silicone, and you will see the same hurt and misery that the silicone implants cause, saline implants cause the same. And in the past, I've used the analogy, if someone smokes a cigarette or a cigar, you will see that the cigarette will cause cancer just like the cigar would, and so you cannot differentiate between one or the other, even though one has more nicotine and less nicotine. We know of the many patients who themselves have explanted successfully with saline implants. Their before and after pictures, their before and after symptoms resolution and freedom from the many signs symptoms of breast implant illness. Yes, that is true. Saline breast implants, when they do rupture, they collapse completely and the saline gets absorbed by the body, but it's that silicone shell that imparts that silicone toxicity to the rest of the body. We know, for example, the silicone emboli on Dr. Atul Mehta's Facebook Live that I did with him and the paper that he published, where a young 45-year-old lady had a saline implant and she had all the signs symptoms of shortness of breath, dyspnea on exertion, which means shortness of breath on exertion. And she ended up getting what is a lung biopsy during one of the workups, and only to show via electron microscopy and energy dispersive x-rays that the silica was embedded within the lung tissue. This was done and shown by a pathology lab out of Buffalo, New York. So that is clear, convincing evidence. Also, one of the patients that came to me that I helped remove the saline implant, I sent the entire saline implant to the doctor in Netherlands, and he was able to, Dr. Henry Dijkman, and he was able to, as per my discussion with him, take that saline on the inside, which is supposed to be the normal saline that babies and kids and all the patients get when they go for an IV. That saline was taken and centrifuged at 11,000 RPM for 1 hour, and then a small pellet was collected, and via electron microscopy it was shown to be silicon spheres of particles that were dislodged by that silicone shell of the saline implant. We know of patients with saline implants who have silicon deposited within the lymph nodes, and so clearly, don't listen to me, listen to the many patients who have had saline implants, who have successfully explanted and have had resolution of their many symptoms. And this is what I said earlier, when the FDA banned the silicone implants, they should have stepped up and also banned the saline implants, because saline implants cause the same hurt. Just ask any patient who has had saline implants, the resolution of the sign symptoms that one will have when the saline implants are removed, along with the capsule and all of that inflamed tissue, such that there is no inflammatory burden left behind. And as you will see, science and that future will only determine the detrimental effects of not only silicone implants, but certainly saline implants. The other thing I want to emphasize, I've talked to a lot of patients, unfortunately, who have gone to other plastic surgeons and they had under local the saline implant drained, or they had under local the silicone implant removed, or many patients who have gone to other plastic surgeons who in a 90-minute period both the implants were removed and the patient was able to work out within a week or two time. And remember, the whole goal of the surgery in my practice is to remove that entire saline implant or silicone implant or the residual capsules, and then to send that capsule off to pathology to make sure it's not that rare BIALCL, which is very rare, to return the implants back to the patient, hopefully both intact, and to take cultures for aerobic, anaerobic, and fungal. And the goal is to remove any inflamed tissue around that implant so that if there is that leaching of the silicone from a saline implant or silicone that has leached out from a silicone implant, even if it's intact or ruptured, that all of it is contained. No need for that unnecessary lift and no need for the unnecessary drains. And clearly, as you will see, the research and the reports that are coming out are showing that the capsule must be removed, and in order for the patient to bounce back to a normal state of good health. And we know this because of two reasons. Number one, you see in the pathology that there is silica, there is non-polarizable light consistent with what is foreign particles consistent with breast implant particles, not in all the pathology, but in some patients. And you will see there is anecdotal and also what appears to be early scientific data that is suggestive that the capsule must be removed for the patients to bounce back to a good state of better health minus the toxins. Look at any web page from any plastic surgeon in the United States, you will see that the word explant, breast implant illness is being used. You will see where the surgeons are talking about total capsulectomy and block resection, which is removal of the entire implant capsule and all of that inflamed tissue and the capsule along with the implant. You will see that the plastic surgeons are incorporating this into their day-to-day clinical practice, and this is what they're offering to the patients despite what is not a major warning by the FDA or the plastic surgeon community in regards to the detrimental effects of the implants. Now, one will mention, to expand on this, no two plastic surgeons are the same. For example, one of the patients I saw today, her surgery was 5.5 hours. On average, I take 4 hours to doing the surgery. It is not the same as someone else who's doing surgery in an hour and a half. This is the whole mindset. This is the care and expertise that the surgeon has to have in order to completely remove the capsule. And in my practice, the implant must be removed along with the capsule, which almost always incorporates the fascia of the serratus anterior, fascia of the pectoralis minor, the fascia of the intercostal muscle, along with the periosteum and perichondrium, such that this ensures complete removal of that capsule along with the implant as one system. In those patients where the implant is above the muscle, the fascia of the pectoralis major is removed along with the implant and capsule. That basically confirms the complete total capsulectomy, preferably in the en bloc fashion. So no two plastic surgeons are the same, and you cannot get the same results in a 4-hour surgery what you would get in an hour and a half long surgery. Remember, for your surgeon to be truly doing the surgery right, he or she has to be a firm believer in breast implant, unless he or she has to have a track record of doing the surgery correctly, where he or she has many happy patients who have attested the fact that the surgeon has done the surgery right. And number 3, there are high definition pictures and videos of the chest wall showing complete removal of the capsule off of the chest, and also the other half video where the entire implant capsule and inflamed tissue is completely removed, and the cutting open of the capsule on the table, so that if the implant is ruptured, it is all contained. And that is another high definition video and pictures attesting to the fact that your surgeon did the right surgery. If your surgeon is explanting only, that authenticates and certifies and gives you the confidence that your surgeon is a firm believer of breast implant illness. Unfortunately, many surgeons feel that if the capsule is thin, it does not need to be removed. That is wrong. As some surgeons feel that the capsule can be cauterized in between the rib, because that is indeed a hard part of the case, and absolutely wrong. That capsule must be completely removed to not give a chance for the patient to potentially not bounce back. We still do not know, uh, as you will see, the scientific evidence behind why the total capsule must be removed, but we know of the many patients who had capsules left behind where they did not improve completely, and only when they went back to another plastic surgeon who removed the residual capsules did they improve dramatically and definitively and completely. And you will hear the patients talk about this on the social media pages. Now, I get this asked a lot. What is it that I need to do in order to learn more about you? This is what you must be doing. You must be talking to the surgeon directly, him or her, so that you can ask directly what is the goal of the surgery. You must have it documented in the consent form as far as that legal bind between you and your surgeon as to why the surgery is being done, what is going to be done, the pictures that must be given, the length of time on average, which takes me the 4 hours, the length of the incision must be the diameter of the implant, if not more, and that the surgeon must have an very good reputation online, so that when the patient signs up, he or she feels comfortable that all of the capsule was removed, number one, and number two, it was sent to pathology, so that you have the peace of mind that all of it was removed. So clearly, going back to the fact the capsule does not get absorbed by the body. I've removed residual capsules even 20 years later, and the capsules were certainly very much there. The capsules have in them the toxicity, as we know, like I said earlier, because of the foreign material that is within the capsule. Not all the capsules have that, and the patients themselves recover definitively. So you would learn more about me by joining the Facebook group page, the Private Breast Implant Illness Support Group page. You will go to my YouTube channel and see the 550 or so videos, listen to the lectures, testimonies by the patients, listen to the hard evidence that I present. Anything that I say is not my opinion per se, it's the hard facts that I formulated together and come up with would be a rational decision in regards to explanting. Once you have read more about me, I want you to then seek me out on a consultation so that you can talk to me. Most of my patients, 2/3, if not maybe 80% of the patients, come to me from out of town, out of state, and this is where they feel comfortable that they can get the surgery safely, absolutely. And this is once they have come and seen me on a Monday, for example, in clinic. The surgery would then happen on a Tuesday, and then the patient would recover Tuesday, Wednesday, Thursday. Friday, the patient would see me. They would have had 3 days to declare themselves. And as you will see, I have not had to, but 2 or 3 patients where I required them to stay the extra over the weekend just so that I would be certain that they would have healed well. This would be, for example, a patient with 800cc implant who came to me from California. She was a mastectomy patient, and she had a lot of inflammation, and I just wanted her to stay the extra couple of days over the weekend so that I would have her go back home and she would have the peace of mind. Just this year alone, I have had patients from Hawaii, from India, from Iran, from Bangkok, from Italy, from Switzerland, from Germany, from the Caribbean, and from South America. And as you will see, the list goes on and on. And these are patients that have come to me from almost every state of the United States. And this is a surgery where I am very much hands-on. So the patients certainly get 100% attention by me in pre-op, from the time we do the phone consultation to the intra-op day, and then certainly post-operatively. And this is the commitment that I have with all my patients in regards to my team that will be giving 110% of their best so that they get the best experience possible. And this is where you must and you need to be talking to the surgeon directly so that you have the peace of mind that all of the capsule was removed and it was all worked up, so that you have the peace of mind that there was nothing left behind. You have the peace of mind that if you did have a ruptured implant, that all of it was contained and there was no spillage of the silicone into the chest. Now, if there's any questions, please feel free to ask. We are right now doing an Instagram Live, Facebook Live, YouTube Live, and a TikTok Live, so that if you have any questions, please feel free to ask.
What should patients consider during their initial consultation with you? Are there specific questions they should ask to ensure they are making the best decision for their health?
So this is a very broad-ended question. As you will see, I kind of answered it. You want to ask your surgeon, what is the goal of the surgery? You want to ask the surgeon, what do you do with the capsules? You want to ask your surgeon, do you put in implants? Because automatically, if I put in an implant tomorrow, all what I have said today goes down the drain. It does not apply because you cannot have it both ways. As my patients have heard me say, you cannot say that the earth is round and at the same time the earth is flat. Remember, breast implants are not lifetime devices. The longer one has them, the higher the chances are that they will require surgery, some of which will require surgery. They are not lifetime devices. They are not meant to be in the body forever. Saline implants and silicone implants need to be monitored closely for any of the signs symptoms of breast implant illness. If there is any fluid around, that needs to be looked into and monitored, and rule out any BIALCL that is very rare, but still needs to be looked up. You need to be checking with the previous patients of the surgeon to make sure that that surgeon is validated. Nowadays, it doesn't take much to support someone financially, and the Facebook group owner will now back you up and basically attest to the fact that that surgeon is a good surgeon, which in reality means nothing. There is no uh, private or public or FDA approved explant surgeon list that's out there. It is all anecdotal. It is all based by what would be a financially based group that wants to favor a local plastic surgeon over another one. And that surgeon may have a very different mindset and may not even completely agree with what is breast implant illness. For example, the patient I talked to from Oklahoma, she informed me that her local plastic surgeon, still augmenting, truly does not believe in removal of the complete capsule, and has at times basically had the implant basically rupture and fall into the chest, such that now the patient is getting drains. And this is where it's a very sophisticated, very tedious surgery, and this is a surgery where no two surgeons are the same, and you want to do your homework. You want to get at least 3 or 5 phone or in-person consultations so you feel content. You want to do the surgery once, you want to do the surgery right, and so once your surgery is done, you want to feel content that your surgeon went and did the best surgery possible. As you have heard me say from the many Facebook lives, I always say 20 years from now, I cannot imagine that the surgery could have not been done any better, because the entire implant capsule was removed, the silicone was contained, none of it spilled into the chest. There was no need for drains, there was no need for the unnecessary lift. And remember, in my hands, just the explant surgery alone is a 4-hour surgery where the blood loss is less than 5 cc's. There is no need for the drains. I do what is the twilight deep sedation anesthesia. I return the implants to the patient. I send the capsules off 100% of the time to pathology to rule out that very rare BIALCL, squamous cell cancer, breast cancer. I take cultures for aerobic, anaerobic, and fungal. And I also take the high definition pictures and videos that I give to the patients if they do ask, so that they know exactly what was the surgery that was done. And last but not least, all the patients who have the surgery done, the goal is complete total capsule removal, that you have heard me say the 100-100-0 rule. 100% of the time, 100% of the capsule is removed, with 0% of the capsule remaining behind, so the patient has the best chance to bounce back, no matter what the underlying comorbidities the patient may have. So that if the patient has COPD or cardiac issues, the patient will be done at the hospital where they have more access. Or if a patient has a high BMI of 42, for example, another patient I talked to over the weekend, she would be done at the hospital, because we don't want problems like obstructive sleep apnea or anesthesia issues to be a potential post-operative problem. Any other questions, please?
Is a capsulectomy similar to a mastectomy in terms of like how much tissue is removed?
No, not necessarily. So if someone has a 800 cc implant, you will see that will have a capsule around it that is equivalent to the volume of, or the surface area of, the 800 cc implant. Now, if this is a young lady, for example, in her 30s, her skin tissue is going to recoil relatively much more than, say, the 70-year-old patient. So her mastectomy scar may be relatively very small compared to her amount of capsule removed. And as you will see, the previous mastectomy scar dictates the length of the incision, so that, if you will, If this is a mound, for example, the previous scar is what I removed for many reasons. Number one, if there is potential recurrence of cancer, that scar is where it's going to hide. So I want to remove that, number one, from an oncologic, physiologic reason. Number two, you want to remove that previous scar because you do not want to have two scars on the patient. Number three, you want to put a scar where it's in the center of the chest and it's going to hide relatively very well. And this will allow for best visualization, for example, of the 6, 7, 800 cc implant. Majority of the patients who have mastectomy scars, they have 6, 7, 800 large implants. And so you want to be able to have the best visualization, and by removing the old scar and being able to remove the alloderm if the patient has that, which is cadaveric skin used in the reconstruction. So the capsule size not necessarily does not correlate to the mastectomy scar.
Okay. How many weeks would a hairdresser have to take off from work?
So if the implant is below the muscle needs to settle back onto the chest and the ribs. That process in itself will take approximately 6 weeks. This is very analogous to someone gets a tummy tuck. You do not want to be post-operatively moving back and forth, right and left, bending, pushing, pulling. Same thing with respect to the chest and the muscle. You do not want to be moving about right and left, and the next thing you know, you are causing shear forces of the muscle with respect to the rib, and also the breast chest tissue with respect to the muscle, and so you want to let that settle. That process takes approximately 6 weeks. If you can imagine you had an implant below your thigh muscle and you remove the implant, you want to let that muscle settle. That attenuated muscle needs to settle back before you start, let's say, walking and running around. Likewise, you can, let's say if your surgery was done today, you could the next day make yourself a sandwich. 2 weeks, 3 weeks later, if you have a desk job, you could be typing, texting, you could be easily driving at day 6, day 7, when your reaction time is good, when you're confident and you're off the pain meds, and that will give you a lot of freedom. Now if you look at a hairdresser job, it's a lot of pectoralis function where you're moving your arms up and down and you're basically using your pectoralis muscle all day. Having taken care of a lot of ladies who work in this profession, this will easily be a 8-week to 10-week recovery before you would go back. Now when you do go back, you don't have to raise your whole arm up. You could just go back and move your wrist and your digits such that you're not necessarily utilizing your pectoralis major muscle. I will caution you, when you start going back to work, you go back to your old habits. You're on your feet, you're working your arms, and sometimes in the middle of all that heat and work, you do not realize how much more active you have been, and then you do realize later on in the day. Some patients who have gone to work in a similar job, they will start using the pec and they will be very sore, and you do not want to delay your recovery. So I look at this as similar to someone who sprained their ankle. So let's say that 18-year-old boy who sprained his ankle playing basketball, 2-3 days later he's playing basketball again, or he's running around. You will see him 4 weeks later still limping with that hurt as a result of not allowing that ankle to heal well. The other nice, smart, wise lady who's going to do the rest compression, ice, and elevation, you will see in 3 weeks she might be running a marathon without problems. So you want to respect the surgery, you want to respect your body, you want to respect your recovery as well, and you want to be able to have a plan such that when you do end up going back, you're not reaching for the jars in the upper cabinet, for example. You're not lifting a gallon of milk. You're not lifting anything heavy. Just like someone who has a knee replacement, they have a recovery period. Just like that explant surgery, you need a recovery period, and you need to get the help and support that you need so that when you do go back, you're not going to take any chances. I find it is a challenge for some ladies who live by themselves, who are moving their arms about, and now they're not letting that heal occur because they have to be moving their arms, for example, and it is very important. 50% is the surgery itself, 50% is the recovery. There is no point doing any surgery where if you're not going to listen to the post-op instructions, because you will run into problems. Just like after a knee replacement, you do not want to be walking on your knee, or just like after a tummy tuck, you do not want to be bending, pushing, pulling. You want to heal optimally, and you want to heal completely before you move on to the next level.
Okay. Someone that explanted recently is complaining of itchiness. Is there anything they can do for that?
So this itchiness sometimes occurs because now the skin was expanded, just like someone who's given birth, for example. And now the skin is recoiling, the tissues, soft tissues are recoiling, the inflammation is subsiding, the stretch of the skin is now going back. And as it does so, just like after a bad mosquito bite, for example, and the skin is receding, you will have a tend to itch likewise. What you want to do is you massage 1 minute 2 times per day, depending on your post-operative course and depending on your surgeon's expertise. You do not want to be bothering or irritating a fresh wound. But let's say, for example, someone is 2 weeks out. When you do massage, you number one moisturize the skin. That helps with that area that was stretched. It helps with the recoil. It helps calm those nerves down which were stretched, which went haywire, especially if the cut involved at the bottom and where a lot of stretch was present. If the patient had a capsular contracture, it helps nerves to come in an orderly fashion towards the surface, and it also helps align the incision very nicely such that the elevated area of the incision is going to settle down nicely. So a gentle massage, not a lymphatic massage, but a gentle massage will help prevent the itch. So that will help you in your post-operative course.
Okay. How do we prevent frozen shoulder during recovery? Are there shoulder mobility exercises that can be done that wouldn't undermine healing?
So if someone has a previous or a history of frozen shoulder, they will continue to have this problem, especially when the implant is below the muscle, which it is in the vast majority of the ladies. Now remember, I have done this thousands of these surgeries, and there are not many ladies who will present with a frozen shoulder. There are patients who get, for example, a rotator cuff tear and they have to be held bound with their arms 8, 10, 12 weeks depending on their level of care, and they still bounce back. So as you will see, the patients are starting to move their arms, and gently they're driving, they're typing, texting, they're doing their regular chores, making coffee, opening gently the doors. So you're not going to lose any muscle mass. Now, if anything, you will only improve on your recovery from this explant surgery, because in the vast majority of the patients the implant is below the muscle, and now anytime the patient uses the arms, the muscle will move and it will basically allow for this quote animation deformity, if you will. You want to let this implant, when it is out, let it heal, and then at the week 6 mark, majority of the patients, or the week 7 mark, some patients at week 5, and again all directed by me, I will have them start flexing their elbows and doing the bicep curls and building not only the pectoralis major but the pectoralis minor, the serratus anterior, the latissimus, the deltoid, suprainferior spinatus, the trapezium, all the muscles of the neck, back, shoulder as well. And so this is very important that you will then rebuild that muscle mass, and your posture is going to improve for the better, and your game, for example, is only going to improve. You're not going to get a frozen shoulder as a result of this surgery. If anything, post-op, your symptoms will only be relieved. Those patients that have a capsular contracture, the breast tissue will get, and the implant, the capsule, it will get so hard and the patient will not be able to move because it's very tightly adhered to the rib. And so once that is removed, you will see the freedom of the movement, the freedom from the inflammation, and the freedom from the mass or the mechanical effect of the implant will allow for a better mobility of the shoulder. So, all right, so I've been given the thumb up sign. That means we're concluding this TikTok live, Facebook live, Instagram, and YouTube live. Please feel free to ask any questions in the comment section. We'll try to do this on Mondays so that I can answer any additional questions. Remember, the best patient is the one who has done informed consent. The best patient is the one who's talked to the surgeon's previous patients, who has read the reviews. Every surgeon must, and this is what I said on my last Facebook Live with my guest, Shan, that every surgeon should have an independent person basically have a page where the surgeon's high definition pictures of the chest video are presented by the previous patients. There is a direct feedback of the surgeon about how long the surgery takes, what the surgery how the surgery is done, what is the opening up the capsule like, who sends the capsules, who does not send the capsules, what are the microbiological findings, what is the philosophy of the surgeon, what is the surgeon's take on breast implant. Unless I once managed a patient, she went to another surgeon who does not believe in breast implant. Unless, how can you manage a problem when you cannot define the word breast implant illness, which is very much well established in the literature. There is no denying the fact, it's not a myth. Not everyone will get breast implant illness, but you cannot say it doesn't exist. And so that is very important. And so one needs to have not another outside body authenticate and certify a surgeon, because no person who has no medical background, no MD degree, no surgery, they have never even stepped into the operating room, they cannot weigh in on another surgeon's expertise. No person can look at another capsule from another part of the world and comment and state that this person is good, this person is bad. Unfortunately, we have, for example, a list that's floating around where the top 10 explant surgeons. Who came up with the list? It was a very smart person who basically put in a no-name explant surgeon so that he could mix the name of other prominent plastic surgeons with his or hers, so that now she gets to be accepted in this pool. Remember, there is no official training by the plastic surgery training programs on how to do these explants on a regular daily basis. Yes, if someone has the BIALCL, the total capsulectomy is mandatory and required. And I'll tell you, I did 0 capsule removals or end blocks in my training. And so this is a surgery where majority of the plastic surgeons are doing what is on the job training, and depending on their whim, depending on their philosophy, and depending on their they sometimes let the patient decide. And remember, this is a problem where you have a defined problem and you have a defined solution. And once your surgery is done, you want to have the peace of mind that your surgeon is a firm believer, is an advocate, and talks and writes about how he does it. And you have the peace of mind that it was a thorough, complete surgery, and that you have no surprises awaiting you. So having said this, thank you very much for tuning in, and please share. Until next week, take care and all the very best.